Our monthly visit from the pet doctor is today. And there's lots of pets.
Sandi Sawchuck is here, taking your calls at 270-9933. Pete is here, up to what? 50 pounds?
Almost 50 pounds, 49.5 pounds.
He
so
doubles in size.
Every time he comes in, I know. I just, you know, but he's in good shape for a bulldog, yeah.
He really, are you seeing a lot of kennel cough?
We are seeing a lot of dogs with kennel cough, and it's primarily dogs that have already been vaccinated for Bordetella bronchoseptica, which is one of the causes of kennel cough. And I think that's something that is kind of misleading. Many people think that just because my dog's been vaccinated, they shouldn't develop this, but there are lots of other causes, viral, as well as other bugs like mycoplasma and things that can cause this too. And so if you're in a situation like doggy daycare and your dog has developed a cough, obviously get them out of there, get them checked, and don't let them go back until they're back to normal again.
And you have to treat them, antibiotics?
Sometimes, if we are considering that it may be something like Bordetella or mycoplasma, it is something that can be treated. One of the things that I'm really worried about is this new, well, not that new, it's been around for about 10 years now in the United States, is canine influenza, which can look like kennel cough in its mild form, but can be really severe. Just like when humans with influenza, you don't just get a cold, you start getting fevers, and and for older dogs that can be really detrimental.
All right, Lola, you're making a lot of noise here.
All right, let's go to the phones, and we'll start with Mel in Elkhorn. Hi, Mel, what's your question?
Oh, hi.
Hey, go ahead.
Hi, thank you so much for taking my call. I have a 12-year-old female, was feral. I took her in to tame her and get her a home. That didn't work, so I kept her. I now have a blended household of 2 4-year-old male cats. They're totally tame, and her.
Okay.
And she's either too aggressive or she's running like crazy, and I don't know how to get them along. I've tried almost everything.
Yeah, and this can be really, really tough. The big thing is time. It can take weeks to months to get cats to get along together. The thing you want to avoid is chasing and fighting. And so keeping them separate, and then you can maybe do stacked baby gates. Some people will even take off a door off of a bedroom and install a screen door, an inexpensive wooden one, so that the cats can see each other, but they can't get at each other. Let all of their interactions be fun interactions where they're happy and contented, such as mealtime. And and sometimes it just never works out, and we just have to live in a house divided when you've got multiple cats. I hope it works out for you, though.
Good luck. Let's go to Marilyn in Richland Center. Hi, Marilyn. Marilyn, you there?
Oh, yes. Hi.
Hi, what's your question?
Oh, I have a dog. I've been told that he possibly has some allergies. And we have been trying different foods and things. And I'm just wondering if there's something that could be recommended to try.
Yeah, I think one of the big concerns that we have with dogs with allergies is, one, it's quite common. We'll see about 1 in 5 dogs has allergies. And I think the other misconception is that food is the leading cause of allergies. And so sometimes what we have to do is kind of step back from that belief and start looking at other things, such as environmental things like house dust mites, pollens, molds, and so on. Less than 10% of dogs with allergies are due to food. So working with a veterinary dermatologist or your veterinarian would be very helpful to try to find out what is actually going on with your dog. And you can do allergy testing, blood testing, skin testing. You've been through it.
Here's the poster boy right here.
Right there for allergies. And then also treating secondary infections, because a lot of the itch can be due to yeast and bacterial infections. And once we get that under control, often dogs can live with the allergies with other medication to help stop the itch.
Yeah, he had all the skin tests. You've been through it with him.
Oh, yeah.
He looks a lot better than he did.
Oh, he did. He was almost hairless before.
Yes, he was. Right, Esty. All right, we're going to take a quick break. If you're on the line, stay there. We'll get to your calls in just a minute.
Let's continue with our calls for Sandi Sawchuck, and we'll go
to Jackie.
Jackie in Madison. Hi, Jackie.
Hi. My dog is 10 years old, and I have taken him to the same vet and to the same kennel for years. And it's been within the last year that he goes into a seizure the minute he gets inside the door.
Oh, I'm so sorry to hear that. Yeah.
And he's an old dog, and I'm so afraid of what's going to happen, and which would be in October.
Right, right. And this would be something to be concerned about. We do know that epilepsy is very common in dogs. And when we see an older dog developing seizures, that maybe is stress related, going to a new facility or something. Sometimes stress can bring them on. But the fact that it started as a 10-year-old dog makes me think that there may be something going on intracranially. And so what you would do in this case, if you want to get some answers, is get some complete blood work done, a good thorough physical exam, a neurologic exam, and then we start looking for cancer other places than in the brain. We do chest x-rays, abdominal ultrasound, and then we do an MRI and have a look. Yes. And hopefully we can find something that can be either medically treated or surgically treated or nothing, and the dog's just got late onset epilepsy that can be managed with anticonvulsant drugs.
Okay, here she goes. All right, let's go to Linda in Madison. Hi, Linda.
Hi.
Hi, what's your question?
Hello there.
Hi, what's your question?
Question is, I have a cat, a long-haired cat, and around her neck she sometimes gets these little scabs.
Yeah.
And my other cat doesn't get them, so
That is the way cats that have allergies often present. What you're seeing is a condition that's called miliary dermatitis. I think it's because the scabs are about the size of millet seeds is why the dermatologist world has given it that name. But probably the #1 allergy is flea allergy dermatitis. And even if your cat is a strictly indoor cat, fleas can still get into your home. So that would be the easiest thing to do is get your cat going on a cat-safe monthly flea control product that you would spot on them. And I would be treating both cats. Just because she's reacting doesn't mean that the other cat doesn't have fleas. It just may be that he's just not a reactor. But that's probably the #1 allergen. But then we do see other allergies that can cause this too.
There's just so many allergies in pets these days.
There are, and I think part of it is the fact that, one, we're living in a really clean environment. It's genetic in a lot of cases, and we're diagnosing it more versus, you know, having a dog or a cat that just suffered throughout their life.
Right. So, thank you, Sandy. We're out of time.
Thank you, Sandy. Thanks for your calls, everybody.
Everybody's in their corner. Have a good night, everybody. See you tomorrow.